Hi, welcome to this Facebook Live on, turns out it's Black Friday, and of course there's a Black Friday deal, but it's Friday the 23rd of November, 2018. And hi, Sarah, thank you for joining. Over the past few weeks, we've had some really interesting conversations and discussions. And so 2 weeks ago, we had a Facebook Live on removing the feeling of dread. And we did that technique where we sort of unwind the emotions. And I thought that was very interesting. And I got quite a lot of good feedback. And it seemed to me that a lot of people had experienced traumatic experiences in their lives. And it also seemed to me that a lot of people who are on the group, right, so our group members, have been struggling with things for quite a long time. Now, the definition generally for chronic is usually something like more than 6 months. I mean, there's a little bit of variation, but it seemed to me that a lot of people suffer with chronic problems. And then I got to thinking, actually, a lot of people seem to be suffering with chronic health problems. And I think what often happens is, and I don't want to be too controversial, but what often happens is that chronic psychological problems can become best friends with chronic health problems. And then we might have, all sorts of issues, things like chronic pain or fibromyalgia, even fatigue to some degree. So what we need to do is, I think, if we want to get some decent traction and make some changes, is to think about how we can identify the psychological processes that are involved. It's hard to give a causal relationship, right? Like one thing doesn't necessarily cause another. Hello, Louise. I'm pleased you found me. What are the processes that are underlining, that are kind of potentially creating in some cases, but certainly part of the process of maintaining chronic problems? So it could be chronic health problems, or it could be chronic mental health problems. I don't think that there's a huge difference in terms of the psychological creating and maintaining factors to some degree. So just want to give people a chance to jump on the call. So please post questions if you have any questions, because it's a long time just to sit in front of a computer and talk. So please post some questions and let me respond to those. And I'll just say that thanks very much for the mind maps. I did worry a little bit that what I asked you to do by making mind maps was a little bit complicated, because of course, hi Catherine. What I like to do often when I have a first meeting with clients, and this is what I was doing on the roadmap, on the the Facebook, on the mastermind group. I gave everyone a 30-minute roadmap call where I made them a roadmap. And in principle, I was sort of asking you to think about making a roadmap for yourself. And I realized, of course, without having help, or without knowing quite what to do, it can be quite a daunting task. So I'm ever so pleased that so many people actually submitted their roadmap. And what I've done is, I have looked at everybody's roadmap and I've synthesized out the kind of the common themes. Now you might think, and it would seem perfectly reasonable to think that your problems are unique to you. And of course your problems are unique to you. But in terms of psychology, there's a lot of people suffer from similar problems. And so I've synthesized out all of the elements of the various roadmaps and I made a list. And I just didn't have time to do it. I was thinking about typing the list out for you, but I thought to myself, it would be useful if you had a pen and paper. So if you've got a pen or a piece of paper that you can grab, that'd be helpful. So why don't you think about, if you've got hands on that, that'd be fine. And I'll just sort of hang on before we get stuck in too far, because I'm going to read this list out, and then we're going to address some of the issues on it, and then we're going to think about what we might be able to do about it, because it's easy to talk about problems. It's much harder to do something about them. So grab a piece of paper and a pencil or a pen, and then we can move on. Sarah says the roadmap was quite amazing to do, but felt a bit daunting. And I did, I appreciate that. I did think it was perhaps a little bit too difficult. Just out of interest, however, whilst we're still waiting for people to jump on the call, for the Black Friday deal, we're offering 20% off. The deal starts at 5 o'clock tonight and it goes till midnight. We're offering 20% off and a 20-minute call with me as the sort of the Black Friday deal. And so it's a sort of a time limited thing, and it's actually quite a big offer in a way, because it's I mean, just a 20-minute call with me actually has quite some considerable value, given that I charge quite a lot per hour when I'm working with clients. Anyway, now these are some of the, let's say, the more psychological issues that we've synthesized from the roadmap. Okay, so one of them is a loss of control, so a feeling of loss of control. And I think it would be almost universally true to say that anybody who struggles with a psychological problem feels that they've lost some of their control. And that means some of the feeling of being able to control yourself in circumstances. So if you felt panicky, for instance, if you actually had a panic attack, you would feel that you had absolutely no control whatsoever. So that would be an example of a real loss of control. But the general feeling of loss of control is a difficult one. Catastrophizing. Now, we're all prone to catastrophizing, and when we catastrophize, of course, we're using the power of our imagination to think of the most devastating and negative possible outcome. And of course, last time we did a Facebook Live 2 weeks ago, when we're talking about the feeling of dread, the feeling of dread is in principle a catastrophization, right? It's as bad as it could possibly be. Intolerance of uncertainty, which was quite a common one. And of course, that's linked really powerfully to health anxiety. Intolerance of uncertainty is where you basically go, yeah, but how can I be sure? Yeah, but what if it actually happened to me? How can I be sure that it won't happen to me? Expecting the worst, which is a bit of catastrophization, but I've just put it in because it's part of the intolerance of part of the catastrophizing. Expecting the worst. Irritable and angry. Now, almost to a person on the group and the people that interact with, people really want to help other people, and they want to facilitate everybody else having a good life. And when that doesn't come back in quite the way that we think it ought to, it's really, almost appropriate to some degree, but then it becomes unhelpful to feel a bit irritable and a bit angry. If we're irritable and angry and then we get someone else to do something because of that, then that's okay. But if we're just irritable and angry and we kind of hold it inside ourselves because we're not entitled to speak about it, that's not okay. And that becomes, anger is quite a strong emotion. And traditionally, and I think Freud was the first person to say this, anger, hi Julian, anger held inside turns to depression. Anger pushed out is a motivating force for change, let's say. So that's quite a tricky one, anger. And here's a question for you. See if you can answer this. So let's type your answer in and I'll be able to check out. Are you entitled to feel angry? Is it okay for you to feel angry? Do you feel that you are entitled to feel angry? Type in yes or no. So just give people a moment to type in yes or no. Are you entitled to feel angry? Yes, it's okay. Well done. Yes. Oh, good. But I don't like the feeling of it. Yeah, that's fair. Okay. I tell you, it might seem like a strange thing to ask, but a lot of people do not feel entitled to feel angry. And just because it doesn't seem like, hi, Anwell. Yeah. Okay, lots of people are saying yes, right. Just because all right, so more or less everybody feels entitled to be angry. It's important to be able to be angry. But sometimes if you don't feel entitled to be angry in some kind of setting, like a workplace setting or a relationship setting, for various fears, you know, if I'm angry, he or she will leave me, for instance, then that's not good. Health anxiety was quite a common one because, of course, we're talking about chronic problems, and chronic problems tend to manifest themselves a lot of times with an element of health problems. Now, of course, depression typically is a chronic problem. Anxiety can be a chronic problem. It just depends whether you do something about it. But depression can be a chronic problem. Along with health anxiety, we have the sort of the physical symptoms of the problem. And when I think about the physical kind of chronic problems we're talking about, the ones that I'm interested in really today are fibromyalgia, tinnitus, fatigue or chronic fatigue, and chronic pain. And I'm going to talk a little bit about each of those and some of these processes that I'm listing and how they interact with those things. Hi, Fiona. Feeling overwhelmed. It's the case that, you know, we all lead busy lives, and in a way it's really quite remarkable. If you talk to someone who doesn't do much, they'll say that their time is taken up with lots of nothing. So when you ask a retired person how they're doing, they say, oh my Lord, how did I ever find time to work? Because of course the tasks that they have multiplied, or they expand to fill the available space. And of course, when you're busy, the tasks contract to fill the available space. And so feeling overwhelmed is a thing that needs to be managed. And it can be managed. It's just a sort of an overgeneralized feeling. We have a lot of, on the mind maps, we had a lot of people saying that they're perfectionists, that they have high standards. I mean, mostly perfectionists. Now, I've said this before, but again, I can't assume knowledge. With perfectionism, there are only two places to be, okay? If I apologize if you've heard this before, but it's worth stating because on the mind map, quite a few people said perfectionist, okay? There are only two places to be. One is perfect, and the other is failure. Because perfectionism is usually an attempt to prevent the most negative thing you believe about yourself being true. So perfectionists are always, you know, highly organized, highly adept at doing things. They're really the people that you want to get to do things, until the perfectionist strategy, which is a strategy to help you to feel good about yourself and to some degree to feel in control, until that strategy goes over the top and it becomes a negative strategy. It becomes like a liability. So perfectionism is something we definitely have to work on, because the truth of it is, these are the two poles we actually need to live in, the bit in the middle. We need to live in balance. We need to live in balance and moderation. Along with that goes the feeling of not being good enough. That's a really common one, and we call that low self-esteem, don't we? Not feeling good enough. And I never met, it's not strictly true, I have almost never met a person whose not feeling good enough thing, right, was accurate. Everybody who feels not good enough about themselves are usually pretty competent, pretty capable, and to be honest, average, right? By definition, we're all average, because that's what average is. And you know, everybody's average, and that's not a bad thing, but it also means that your personal value, your sense of personal value, is not less than anybody else's. Now, you might feel that it is. You might cognitively, you know that it's not, but you might feel that it is, and that's an issue that's going to cause all sorts of problems, including depression. Mind racing. Now, that goes to worry a lot, doesn't it? Because worry is the kind of the thinking part of anxiety, right? If your mind's racing, typically would say it's either racing on worry, it's racing with all sorts of things I've got to do, or it's racing with all of the things that I've done wrong, which we'll call rumination. Fear of criticism. Now, there are some circumstances where you might get criticized, but almost always your fear of criticism is way greater than your actual experience of being criticized. In normal life, we don't get criticized. If you're just doing like a regular normal experience, you just don't get criticized. I mean, And even at work, you're unlikely to get criticized. Things could be asked, people could ask you to change things, but you're unlikely to get criticized in the way that it's here. And likewise, you have fear of confrontation. If you're frightened of having a confrontation, what's in control of you? The fear of confrontation. And that means that you're going to, you're always going to be watchful and wary in case something that you say gets taken the wrong way and causes a confrontation. Now, many years ago, I used to work with a man who was a giant of a man, actually, and he's from Northern Ireland. And this is when I was in the Berkshire Traumatic Stress Service, and he'd been really like maliciously run over by a van several times, you know, lots and lots of injuries. And he was a giant of a man, and he'd come in with these great big hands, and he'd say, "Oh, Dr. Purves, you're a miracle worker, Dr. Purves." Anyway, so he'd sit down, so he'd chit-chat, and he says, "Oh, I'm terribly frightened. I'm terribly frightened of walking down the path." Now, he walked on a tow path beside the canal to come to my clinic. He didn't drive. I said, "Well, really? I mean, you know, you look like a giant, and why would you be frightened?" He says, I'm terribly frightened that I knock some kid off his bicycle into the canal and his dad will have a go at me," which, you know, is quite specific, right? And I said, "Well, okay." And I just got curious. I said, "Well, how do you walk down the canal?" Just out of interest. And he stood up and he shuffled alongside the wall of the room I was in. So basically he's facing the wall and shuffling along, facing the wall, making himself as small as possible on the off chance that he'd knock a kid off a bicycle on a towpath into the canal and the father would have a go at him. I said, "Okay, well, how does that make you feel walking like that?" He said, "Oh, I'm very frightened. I'm very frightened." So I said, "Okay, well, do you think you have as much right to be on a path as anybody else on a sidewalk?" He said, "Yes, I do." I said, "Okay, but when you walk like that, how does it make you feel?" He said, "Well, it makes me feel very frightened." I said, "Okay, so maybe you need to walk as if you own the path, right? With your head up instead of your head down, facing forward, walking forward. And if you do that, how many times have you bumped into people in your life?" "Well," he says, "never, you know, never bump into people." "All right, okay. So if you're looking forward and you're facing forward and you're a big presence on the path, what's the chance of some kid on a bicycle bumping into you and then bouncing into the canal?" He says, "Well, not really." Okay. So that was his homework. Walk down the towpath, facing forward with your head up. And he says, "That's just changed my life, Dr. Purves, changed my life." And so every time I saw him, and I saw him for quite a long time, he'd say, "I'm still walking down the path with my head up." So I find that's a good example of fearing confrontation. And I have to say, given that he was a giant, it's unlikely that even if he did knock some kid in the canal, that the father would have a go at him. The father would probably say, "Sorry, my son bumped into you with his bicycle." And I'm anyway. Now, lack of energy. I'm always struck between how much energy it takes to live. I mean, it takes a lot of energy just to live, right? It takes a lot of energy just to do stuff, and yet we have that energy within us. We have that resource of energy, and you can, you know, flop down on the settee at night and watch a bit of TV and go, "Whew, that was a busy day," but it actually was just a normal day. You know, it was just a regular kind of day. So the energy that we have has to be, in a sense, husbanded and managed and controlled. Now, the brain uses a huge proportion of the oxygen in your body in the thinking process. And I sometimes liken it to, there's a thing in computers called cycles. So the chip in your computer uses sort of cycles of energy. And so if your brain's occupied with anxiety or depression or worry, or if it's very, very active, or if it's doing lots of stuff, it's quite likely to be the case that you're using up quite a bit of your energy in a non-productive way. And if you're using your energy in a non-productive way, it's not available for you in just the normal life experience. And that brings us to exhaustion, of course. And then just the last couple, negative self-talk, being self-critical, and that kind of really goes to perfectionism and also self-blame. So there were so just as an interesting question, so Sarah says, I have a question. I get lots of praise and validation, but I don't acknowledge it. If I do, it's fleeting and soon forgotten. Why is that? Usually the reason is because you don't believe it. Have you ever considered this? Given that, if you take my kind of virtual reality simulation of the world kind of idea, right, where we simulate the world inside our head, so we don't respond to the world, we respond to our interpretation of it inside our virtual reality simulation. And, you know, watch my video on drpurves.com and it'll tell you all about that. If you're running a program in your virtual reality simulation that says that you have to be perfect, or you're not good enough, or that it's never going to go right, or that there's something wrong with you, and these are really common ones, right? So basically you feel like a fraud, or you feel like you're going to get found out, or you feel like an imposter. And if anyone got imposter syndrome, so if anyone feels like they have a bit of imposter syndrome, give me a thing, a thumbs up or something, and it floats up my screen, and that's nice. A bit of positive reinforcement for me. Your belief about yourself is that you're not good enough. Okay, so if someone says, "Oh, great job," you're likely to say, "Well, I got away with it," or you're likely to like just brush over it because it's incongruent with what you believe about yourself. So thank you very much, Sarah. So what you believe about yourself is more important to a very great large extent. Oh, thank you. Thank you, everybody. What you believe about yourself is the most important thing, far more important than external reality. You could have 100 people telling you did a great job, but if you believe you're a failure, all you're going to think is, I got away with it. They haven't found me out this time. They'll probably find me out next time. And how could I possibly sleep? So, you know, the internal world, the psychological world is incredibly important to what you actually do in the world and kind of the outcomes you have. Now, I took the mind maps that people did. So I've done the psychological list, and now we've got a list which is a little bit more somatic, which basically means a little bit more physical, a little bit more behavioral, not going out. So that's, you know, that was on someone's mind map as an example of one of the things that they don't do, or they do, right? Another one is avoidance. So not going out and avoidance are two guaranteed ways of restricting your kind of world, right? If you think about your comfort zone, well, I'll tell you a funny story. I think most of my audience here, in fact, all of my audience here are female. However, I presume you've never ever been in a gentleman's toilet. Well, a gentleman's toilet have these urinals, and you stand at the urinal and you do your thing, right? Okay. Now, there is a certain space that men require around the urinal to feel comfortable doing their thing. Now, doing your thing is called micturition, and some people did a study. They restructured a men's bathroom, and they put the urinals very, very close together, and they timed how long it took people to be able to complete their business, right? Or even to start. But anyway, so if the urinals closer together, it takes men longer to do what they need to do because they're more anxious, because their comfort zone is being invaded by other men by proximity, you know. And so, you know, in principle, you can stand there, you know, and it's really quite interesting, right? It's a brilliant example of comfort zone. And now, of course, in terms of talking, right, in the UK, we have our particular comfort zone, and it's traditionally said that, you know, in, let's say, Arab countries, it's closer, African countries, it's closer, you know, whatever, right? So that's your comfort zone. If you don't go out and if you avoid stuff, you are artificially constricting your comfort zone. And let me ask you a question. Do you think that makes your life better or worse? Does not going out and avoiding stuff and making your comfort zone small, does it make you happier? Does it make you less happy? Does it make you more anxious? Does it make you less anxious? So tell me, does constricting your comfort zone make you feel better or worse? Type it in for me, please. Better or worse? Let's see what you agree with. And then, of course, you need to think about the reasons. But does constricting your comfort zone make you feel better or worse? Worse. Worse. On the face of it, right, almost everyone's going to say, well, it makes me feel worse. Yeah, okay, yeah, worse, anxious, more anxious. But you're also likely to say, but I can't help it. And if that's the case, that's the psychological issue, right? So the behavioral issue is avoiding going out, avoidance, and the consequence of that is restricting your comfort zone. But the reason for not going out is what's more interesting. And that brings us to, in a sense, well, I'll just throw this in and we'll visit it again. I was asking for questions on the Facebook group, and the kinds of questions I got were, how to get over chronic health problems, how to recover from chronic problems, how to recover from fibromyalgia, how to recover from pain. Okay, these are not the problem. Now, what I mean by this is, and I always say this, and so I apologize again because I forget what I say. Fibromyalgia, pain, are not the problem. They're a bunch of symptoms, and we can assume that they are the problem, in which case, what can we do about it? Well, what we have to do is we have to go to the doctor and get some painkillers. We have to, try a supplement. We have to try all sorts of things. But the thing that makes them chronic problems is these problems are not easily solved by medical solutions. I mean, chronic pain is not easily solved. I mean, you can take painkillers and stuff, but the actual problem itself is not solved by a medical solution. Now, obviously, sometimes people have nerve blocks and they have operations and stuff like that. Okay. Even then, they can continue to go on and have chronic pain. Fibromyalgia is not solved by a medical solution. And I've worked with numerous people over many years who've tried all sorts of things. And sometimes they find just a combination of antidepressants that work, but they change the antidepressant and it just stops working. So if we focus our attention on the symptoms, which is basically the label that we have, we're not able to do much about it because we're not. Your doctor can't do much about it. I mean, who can? And to be honest, who cares about your health more than you do? So this is why we're thinking about the psychological process behind. Anyway, let me just finish my little list. So these are the more behavioral and the more somatic problems, which is physical problems. No energy, pain all day, brain fog, fear of not coping, that's a bit psychological, relationship worries, being bullied, fear of a workplace, fear of being blamed, and dissociation. Now, not one person put dissociation on their roadmap, so I've added this. And the reason I've added it is that you might not be aware of dissociation, but it's really commonly implicated in things like fibromyalgia, pain, and to some degree fatigue. Dissociation is an alteration in consciousness, and is typically thought of as a way of protecting yourself. So, for instance, if you can't remember something, but it's a memorable event. So if you had an accident, for instance, or a traumatic experience in your life, and you can't remember a bit of it, a probable reason is that you've dissociated. And it's very common for people who have abuse histories to dissociate. And it's like taking a bit of yourself away from the experience to protect yourself from feeling the full force of it. However, if when you try to work on it or when you think about it, you dissociate, now that dissociation, which was originally sort of a bit helpful, now it becomes a downright problem because you can never process the emotion in it and it kind of gets stuck in your body. Does anyone have the experience of having traumatic experiences that feel stuck in the body, having not moved on in a way? So give me an example if someone's got one of those. I'll just say yes. The phased out feeling, yes. Yeah, lots of forgetfulness daily, yeah. Okay. So those dissociative kind of experiences need to be dealt with, and I'll tell you a really kind of simple and easy way to deal with them at the end. Okay, so what we have, therefore, is a whole list of psychological characteristics that everybody has ticked some of these, and I've extracted them, and then we've got the more behavioral, the more physical ones, the more somatic ones on the other list. Now, here's the thing. Chronic problems tend to suck you into them like magnets. You're an iron filing, and your chronic problem is a magnet, and it sucks you in, and you lose awareness of yourself. And so that's why over the last 2 weeks we've been posting this notion, right? I am not the problem, but I have a problem. Now, chronic problems make it really hard for you to recognize I am not the problem, but I have a problem. Because you lose awareness of yourself separate from the problem. And because the problem's been with you for such a long period of time, in a sense, it can become like I am the problem, right? This is me. What would I be like without this problem? And that connection is really troubling, because if you are the problem, then there's really nothing you can do, is there? I mean, you can say, well, I could work on myself. Yeah, but you're the problem. I could go on holiday. Yeah, but don't take yourself with you. And I swear, you know, I've said to this many people many times, I'm emigrating to Australia so I can have a fresh start. Be sure you don't take yourself with you, because then you're not going to get a fresh start. You're just going to have a change of circumstances, and you have exactly the same problems come around again. So we need to establish, and in a way, if you believe that you're the problem. Now, I know we're talking, right, and you can say, no, I'm not the problem, I've got a problem. Yeah, but actually, do you feel that you're the problem? Do you feel that whatever chronic problem you struggle with is you are the problem? Because if you do, that's the problem that we need to work on in the first instance. It needs to be, we need to establish in external reality, like this is true, but I don't necessarily believe it, right? I am not the problem, but I have a problem. We need to get that established as just something we need to work towards believing, okay? So that'd be the first thing, because that separation, I have a problem, enables you to see your problem, and it enables you then to work on this list of psychological characteristics that, you know, will make your problem less. So for instance, if we think about chronic pain is made worse, and typically the statistics about 15%, but you know, it varies with people, right? Chronic pain is made worse by depression. If you're depressed, your perception of pain, and pain is a perception in the brain, your perception of pain will be much stronger than if you're not depressed. So irrespective of what physical kind of, you know, burden that you have, yeah, it feels like a problem magnet, yeah. Irrespective of what physical burden you have, if you're depressed, this is going to make your burden feel worse. Therefore, it makes sense for us to work to not be depressed. Okay? Now, with respect to fibromyalgia and chronic pain, well, actually, fibromyalgia is an interesting one, because it was just a paper published last month, which got my attention. Fibromyalgia has the quality of reducing your ability to it has the quality of capturing your attention. So your attention becomes captured on symptoms, and it has the quality of reducing your ability to switch your attention. So you've got two problems. If you struggle with fibromyalgia, and this is going to be true of chronic pain as well, it's your ability to recognize symptoms and to focus your attention on them is greater than people who don't have your problem. Now, what that means is that a thing that I might recognize but not pay much attention to, you might recognize and put a lot of attention on. And of course, we know that when you focus your attention on something, it makes it stronger, right? So if you've got an itch somewhere, and you're delivering the sermon at church, right? And all of a sudden you've got an itch in a funny place, and you think, oh, I can't scratch that itch. Does the itch get worse, or does it get less strong, right? It typically gets worse because you can't do something that you feel you want to do, so you put attention on it, and that makes it worse, right? So if you have symptoms of pain, discomfort, you know, something unusual, something mysterious, something that's, you know, just a bit uncomfortable, it captures your attention. And because you're the problem, not because I am the problem rather than I have a problem, it captures your attention and it focuses your attention, and you are inhibited in switching your attention to something else. So not only is it going to capture your attention, it's going to hold your attention for longer than it might hold my attention or someone else's attention. And then it's going to make it harder for you to switch out. And the final nail in the coffin to a degree is it's going to make you catastrophize. People with fibromyalgia and chronic pain catastrophize much more, significantly more than people who don't have these problems. So you're kind of used to thinking to yourself, oh, this could be this could be something serious, this could be something like really important, this could be something I need to get checked out. So these are psychological phenomenon that make your problem more likely to persist, and in fact, you know, they could create your problem to some degree, because you're over focusing on things that in all likelihood aren't important. You know, if you have a chronic problem, you've had many experiences of symptoms, right? And how many of those are so important that you need to rush to the hospital about? They're mostly just phenomena that your body, you know, kicks up because it's a consequence of whatever you're struggling with, right? They do not need the level of attention that they get, but because it's hard to switch your attention out and because you catastrophize, it holds it there. So my general motto is that we make our problems fresh every day, and that is a good example of how we make our problems fresh every day. We over focus our attention on them, and we make them to some degree a big element in our life when they need to be a small element. And that brings me to so I've got a little list that I'm working through with respect to things that we need to focus our attention on. So the first one is you are not the problem, but you have a problem. That needs to become true if it's not already true. The second one is that commonly symptoms grab our attention and make us over focus on them, and that makes the symptoms feel more significant, which makes it easier for us to catastrophize, which makes us feel rather helpless and hopeless. And chronic problems by definition are long-standing, and that means they have the force of habit behind them. And that means, if you think about habit, right, a habit is automatic. So you don't think about habits, you just do them. And so if a problem cluster of symptoms have the force of habit behind them, you're just going to do the symptoms without any thought. And so if we want to change this, how we feel about the symptoms, if you want to change the symptoms, we have to change what we do. And that means that we have to change what we do with respect to our behavior, right? Because symptoms make us do stuff, and we have to change what we do with respect to our physiology. You know, we have to change our kind of our stress level, our relaxation level. We have to change our exposure to exercise, or all other kinds of things, right? We have to change what the negative, unhelpful habit makes us do. Otherwise, the habit will persist because it has the force of habit behind it. So if you struggled with something for 10 years, you know, that's a lot of habit, right? And so it takes, I have to say, you know, it takes courage and it takes nerve and it takes practice to change those habits. But what's the alternative? And I think that, hi Jennifer, what we need to do is we need to sort of treat ourselves a bit like a scientist. Now, I'm a scientist and I do my thing. I like being a scientist. And I think I would advocate that you treat yourself as a scientist. Now, what does that mean? It means that I think it'd be very useful for you to become curious about what causes and maintains the problems that you have. Again, I'm not a problem, but I have the problem. And that means, okay, so what psychological process am I using that's making this problem bad today, right? That's a question. And so we might say, well, okay, yeah, I was catastrophizing. That's what did it. And so we want to think about things like that. Okay, I'm doing the perfectionist thing. I know it's not perfect. That's why I'm feeling like a failure, right? So we think of ourselves as an experiment. And that then gives you a sort of a position. It gives you like a remit to research and to be interested in the things that you're doing. What we can't have, if we want to have a different, if you want to transform your experience, you can't persist in like being unconscious to what's happening inside you. So if you were to say, if you went to your doctor and you said, I have IBS, your doctor would say, okay, well, here's some, some magnesium-based medicine, try and avoid stress. And if that's as far as it goes, right, I have IBS, that's it. You are not being active in your treatment. Now, you might look for supplements and you might look for all sorts of things, but in principle, if you've got IBS, you need to be reducing your anxiety and you need to be managing the psychological things which cause you stress. And as you know, I say stress is an option, right? So you have to become an active participant in your own health care. I mean, I call it personalized healthcare, but your health matters to you more than it matters to anybody else. And that's why I would like you to become a bit of an experimenter, a bit interested in what's causing things to happen and what's like making things happen. Now, if you went to your doctor and you said, I have this problem, your doctor would give you pretty much a medical solution. And he's probably going to prescribe a medical solution for that problem, right? If you ask a surgeon, he's probably going to give you a surgical interpretation, a surgical solution. If you ask a psychiatrist, he'll give you a psychiatric interpretation and again prescribe you medication. If you ask a psychologist, which is me, I'll give you a psychological interpretation and I'll suggest that you do some psychological stuff. My suggestions are harmless. Most of the other stuff requires you to take stuff or have surgery in my examples, right? So becoming your own psychologist is really powerful. Now, what do you do with this? I used to do research in a thing called, I used to do research in trauma, but the interesting thing about trauma is if you can talk about your traumatic experience, freely and feel that you're heard, it reduces the likelihood of you having some kind of, more severe PTSD later on. Now, a lot of trauma, particularly, in childhood, tends to be retained inside for various reasons like shame or just no one to talk to or tons of self-blame, this is my fault, I made it happen, that kind of thing. But there's been a lot of research by a fellow called James Pennebaker who basically says, if you are able to process your experiences, your emotional experiences, and this is not just trauma, this is all emotional experiences, if you're better able to process them, then it stops them from turning into something else. So he did a study and he got university students to write in a notebook the things that had happened to them and how they felt about them and basically just process their emotions. And he got them to do that for a period of time. And over the next 6 months, he monitored how many times they went to the doctor. And they went to this doctor significantly less from the simple task of writing down how they feel and expressing their emotion in a private diary. And I think that's an interesting one because if you want a way forward from a chronic problem, obviously a quick fix is not going to be applicable to a chronic problem, right? But something that's low touch, really easy to do and effective is to write down how you feel and what you think about things and what sort of processes you can identify. And I made a list for you here, what processes you can identify and how it's affected you. So in a sense, you're kind of exploring your inner world. You're an explorer in your psyche and you're writing it down. And that process itself is sufficient to reduce some of the consequences of, well, in his experiment, right? You reduce the amount of times you're at the doctor. I would suggest to you it will reduce your overall burden of chronic problems. Now, likewise, I asked you to make a roadmap. If you remade your roadmap, given what we've talked about and given everything else that we've done, right? If you made your roadmap and you sort of had 15 things on it, and suppose you determined to work on one of those 15 things for a week, okay? So let's say it's perfectionism. Let's say it's fear of criticism. Let's say it's power and control, or loss of control, or let's say it's catastrophizing, right? If you spent 15 weeks and you worked on one of those things through a week and you kept a record of what you did and you kept some notes and you thought about it, I would suggest to you that you will have come a long way in 15 weeks. I mean, that level of attention to what's happening and what's going on is absolutely guaranteed to give you an outcome. Now, you might not get to where you want to be, but you won't be in the same place. Absolutely guaranteed you won't be in the same place, because you're doing something constructive in a useful way, as opposed to, I am the problem, and I'm sitting in a puddle, and I wish my bum wasn't wet. Okay. Now, I use this phrase, and it's like retraining your brain. Okay. If you've done any work with me, or if you're on the Panic Pit Stop program, or you're interested in it, what we're basically saying is we can change what we think about things, we can change our beliefs, and we can change how we feel emotionally, we can change our physiology, and we can change what we do. So the cognitive behavior therapy approach is basically, we're going to change our beliefs, our thoughts, our cognitions, our emotions, our behaviors, and our physiology. And we input in all of those areas one way or another. And in so doing, we retrain those negative processes that give us our anxiety, that give us our panic, that give us our depression. Okay, so if you've been through my app, Panic Pit Stop, and if you've been through the program, or if you're interested in the program, if you've been experiencing chronic problems for a while, you are, and I know this sounds weird, but I kind of like it, right? You are practicing being anxious, or you're practicing being depressed. Every day that you experience anxiety, you are practicing being anxious. Every day that you experience depression, you are practicing being depressed. Now, there are things that we can do on a day that we have anxiety that are more useful, and there are things that we can do on a day when we have anxiety that are less useful. So Catherine says, when my symptoms are bad, I know the day is going to be a struggle. What's the more helpful way to think about it? Well, I'll put some extra words in for Catherine. She knows the day is going to be a struggle, so that's a little bit negative, isn't it? And it's potentially a little bit catastrophic. And when we put negative emotion in, we tend to focus on the negative outcome. So if you genuinely believed your day was a struggle, and that was something that you focused your mind on, your day is likely to be more of a struggle. But I'll bet you've had the experience of forgetting that your day is going to be a struggle, and actually it turning out to be better than you thought it would be. And I'll also bet that you've had the experience of catastrophizing about something that you're going to do, and then when you did it, it turned out to be much better than you thought it would be. And so you're able to cope, and you're able to manage much better than you give yourself credit for. So if we catastrophize, and if we kind of like predict the future, it's going to be terrible, and as a consequence, we stay in, and every time we do that, we narrow our comfort zone and we kind of avoid stuff, then we have reinforced that negative thinking. But if we say, oh, it'll probably be a struggle, or it might be awful, but then we go, but you know what? I'm stronger than I feel I am, or I'm safer than I feel I am. And then we do the thing and we go, actually, it wasn't as bad as I imagined it would be. We have taken a positive step. And that choice, I always draw it like a V, right? So that's the V, right? That's a V. So here is your journey. And quite commonly, you come against a choice point, and that's that bit there, right? You can go that way, or you can go that way. That way is negative avoidance, narrowing comfort zone, and allowing the symptoms to be in charge of you. That's that one. And this one is, do you know what? I'm going to do it anyway and see what happens. And it's not as bad as I thought it would be. And so as we reach these choice points, we're deciding to have a better experience, or we're deciding to have a worse experience, if we accept that we have a choice. But that means I am not the problem, but I have a problem. If I am the problem, I have no choice. I have to stay in my bedroom because it's too frightening to go out in the world. But if I am not the problem, but I have a problem, now we can make a choice, because actually we're actively working on moving forward. And I would like to sort of suggest to commit to having a better experience. When I'm reading and responding to posts on the Panic Pit Stop group, I commonly think, well, okay, but what are you doing about it? So it's important to commit to having a better experience. If you don't commit to having a better experience, well, you're possibly leaving it up to fate, or you're possibly leaving it up to chance, but you're not actively constructing your future. See, many thousands of people go through psychological therapy every year and feel better. Many millions of people don't go through psychological therapy every year and don't feel any different. Now, sometimes people use antidepressants, but we're not going to talk about them. You have to take control of your experience and make your outcomes, make your life turn out how you want it to turn out as best you can. I say that's your responsibility. Now, no one else cares whether you do it or not. The people that care about you, they care to some degree, right? But they're getting on with their own lives. You have to take responsibility for your life. And I would suggest commit to having a better experience. Use this exercise that I'm suggesting of keeping a diary, of writing about catastrophizing, writing about perfectionism, and trying to do something about it, you know, using some tools that I've provided for you. And actually commit to having a better future as opposed to having the same, right? So it's like deciding to have a better future as opposed to letting it be what it is and let random chance take me wherever I want to go. So I hope that's sort of been somewhat useful. It's a big topic, and I thought we'd take the mind map route because it's a good way of just like getting underneath the symptoms, which are, I mean, there's no point in talking about symptoms because they're not the problem. They're just a consequence of the problem. The problem is catastrophizing and attention problems and all sorts of other things. Okay. It's Black Friday today, and so I've made this deal, and some people were interested in this. So here's the deal: 20% off the Panic Pit Stop program bundle for life, which basically means it will be 14, more or less £14 a week, and you get the whole Panic Pit Stop program bundle. You get Panic Pit Stop, mindfulness journey, insights from the clinic, worry tools, mood control, and as an additional bonus, you get a 20-minute call with me, which in itself is worth more than the first month, because a 20-minute call with me is about £45 if you think about what I charge for actually clinical work, right? So that deal is available between 5 p.m. tonight and midnight today, and then it's gone, because actually, it's a heck of a good deal. So it's 20% off the whole thing, everything for life, and as long as you stay subscribed, and a 20-minute call with me. And what we'll do is we'll set the 20-minute call up after you've joined, and we'll probably do it next week in the evenings or whatever, what type of time suits you. And I would like to do that as a roadmap call. I mean, we can talk about anything, but I think it's useful to have a roadmap. And in 20 minutes, I can get you started on a pretty good roadmap that will focus your attention on what you need to do to feel better. So there's still time to transform your life and feel a bit better by Christmas. So I hope you've enjoyed this broadcast. If you're interested in retraining your brain, I would urge you to take the 20% and 20-minute call with me offer. You don't have to have the call, by the way, but it's just there. Take the offer and get started, right? You can start today. You can start immediately to start working through the programs, and I would predict that you'll get a good outcome. So thanks for taking the time to watch and listen. This is available as a download that you can just get off the Facebook page, and it'll be on my YouTube channel soon. Okay, thanks a lot. Bye-bye.